Welcome to Therapy Playground. I'm Kelly and this is Jen, and we're here today to talk about developmental milestones for speech. Jen, can you give us a brief overview of what developmental milestones are?
Developmental milestones in speech and language are items that we use. They're markers at different ages that we use to determine whether a child has delays or not and is in need of therapy. The milestones are so important because they are incorporated into the standardized testing that we give during an evaluation, and so it really lets us specifically compare one child's skills with a group of children that have been used as normative data for the evaluation.
Now, what to expect in infancy? Why would developmental milestones in infancy be so important?
A lot of people do not realize how important speech and language is during infancy. During that time, a child is learning how to make eye contact. That's something that we do in conversation to take a turn or to terminate a turn. The child is also learning how to imitate sounds. So when mom coos at the baby starts cooing. And we also start learning different sounds. We make our vowels first, like ah and oo, and then we start making sounds that are classified as stops, like ba-ba, mama, papa, da-da, ka-ka. And so these things are very important. By the end of that first year, we also see children being able to understand what things are called. So if you said, "Where's your nose?" they might point at your nose. If you said, "Where's mommy?" they may point at mommy. And so it's a really fun time where children should learn a lot of things without direct teaching.
That's awesome. What's the difference in toddlers? What would we expect then?
Once a child turns 12 months, between 12 and 18 months, that's really a critical time for them in which we see a lot of children who need therapy. By 18 months, a child should have 50 words in their vocabulary. And a lot of parents come to us and say, you know, our child's not speaking. They're 18, 19 months. What should we be doing? By 2 years of age, a child should have 250 words and be able to put 2 and 3 words into sentences. And so they should also be able to understand simple sentences like, go to the bathroom and bring me the hairbrush, or go out to the car, it's time to leave. They should be able to follow directions. And so we see a lot of children in toddlerhood who begin to fall below those developmental milestones and need therapy at that time.
Mm-hmm. And what about preschool age? What would we expect then?
Well, by the time a child is 3 years of age, we should be able to understand 75% of what they say. And that's 75% to an unfamiliar listener, so someone who's not familiar with that child. A 3-year-old should be able to say 4 to 5 word sentences without difficulty. And by the time that child enters kindergarten, they have probably mastered 90% of all grammatical structures needed through adulthood. So, as well as 90% of the sounds that they need for adult-like speech. So those first 5 years are really critical time for children to get therapy, as well as graduate from therapy before they get to kindergarten.
Mm-hmm. And that's important to graduate. What about parents who have their kids here or are thinking about coming here and they're going to get their trip to the pediatrician for their well child check? What should the pediatrician look for?
A lot of times at pediatrician visits, they do a well child questionnaire. It might be something like the Ages and Stages questionnaire. It's also called the ASQ. And they do that at different ages to determine whether or not the child has delays. So they may ask parents questions designed to target those milestones to see if the children pass or fail the screening. If they do not pass the screening, the pediatrician has a few options. They can say to the parent, okay, we are going to wait and see, take a wait and see attitude, or we can refer for an evaluation. And a lot of times it depends on what the parents' concerns are.
Now, what if that pediatrician says, let's take the wait and see, and the parents are not wanting to do that? What can the parents do?
The parents, in a lot of situations, become very frustrated because a parent's heart, to me, is one of the most important things in the treatment process. If a parent feels that there is a concern, I feel that somehow, some way, they should get an evaluation. Now, if they're birthed to 3 years of age and they need their pediatrician to sign off for insurance purposes, they can always go through the infant toddler program to get a free evaluation. If they're 3 to 5 years of age, they can always go through the local preschool program to get a free evaluation. But if the parent really wants to use their insurance to get an evaluation, I would recommend them go back to their pediatrician, talk about it again, maybe create just a running list of the concerns, specific situations in the home environment, maybe even make a videotape of the child in the home environment to show to the pediatrician. They can ask the pediatrician to refer for a screening, or they can call an agency like Therapy Playground to get a screening. They can also go ahead and pay out of pocket for an evaluation and not bill the insurance. Unfortunately, most states do require a physician's order before that evaluation can be done.
Now, once the parent gets this evaluation, how do we determine if the child needs therapy from that?
Well, it depends on what they're referred for. If the pediatrician just refers for a screening is usually a yes or a no. They pass or they fail, similar to a vision screening or a hearing screening. So the child would come in and we would do usually a questionnaire check sheet, and at the end we would tell the parent whether or not they needed an evaluation. A screening does not tell us whether or not they need therapy. They just tells us whether or not they're at risk. If the pediatrician is able to refer for an evaluation, then the child would come in and we would do a standardized assessment that has norms, that has a group of children who've been tested previously using that test, and they create norms, and so we're able to look at the child in front of us at their chronological age and then compare them to those norms and to see whether or not they are exhibiting delays. Typically, we can look at the language, which is how they communicate, and then we can look at the articulation, which is how they produce sounds. Compare them to our norms, and then tell the parents whether or not the child is typical, whether the child needs therapy once a week or twice a week. Most of our children who have mild delays get therapy once a week. Moderate and severe delays, they get therapy twice a week. We can also tell the parent that we'd like to see them back in 6 months for some follow-up.
Okay. Well, you've given us a lot of really good information today. If you have any further questions, feel free to give us a call here at Therapy Playground. Thank you.
Thank you.